under the topic of stress. Now, to be clear, there's a lot to cover in this. And again, the same thing is happening that happened last week. I have not worked out how to get the slides to change sometimes. There we go. Can you all see the slides clearly, I hope?
Yes.
I'm trying to move the chat across. I'm trying to get rid of the pictures. Okay. Right. What we're going to do is we're going to do a little introduction right now where you can do a little exercise. We're going to cover the principles of psychological first aid. Basically, every one of these 7 topics could be, not number 7, every one of the first 6 topics could be a whole lecture in itself. So in this 1.5 hours, I'm going to introduce you to what I think are key issues around what I've learned from refugees and self, probably the most important thing, about self-care, about the formal treatment of stress and stress disorders. I'm going to end with some useful techniques. I'm going to highlight them again, not do them fully. And I'm going to point you because there is a mass. I mean, I've never seen such an amazing amount of resources online. I've given you some key websites where you can find more. And so you can follow up all of this, or I can come back to teach on any particular topic at a later time, not next week because I'm not available. But anyway, let's just go on. So, okay, the first thing is an exercise. In the chat box, I would like you to briefly, you don't have to tell me what this upsetting experience is. That's not the point of the exercise. Just to remember, it might be a loss, it might be an accident, you might have been involved in a natural disaster, a flood or something. What I want you to share in the chat box is 3 things that helped you cope in the first week, just in that very first week. What helped you cope after that event? Don't tell us about the event. We don't want to know. We want to know after that event, what helped you get better? What helped you cope? 3 things if you can. 1 if you can't, just put it down in the chat box, which I'm going to be watching right now. I'm going to try and watch it. Sorry. Yeah, there's the exercise. I'm having difficulty getting to the chat box. I don't know why. I'm going to reduce my screen. You all know the exercise. I'm just going to reduce that so that I can get at the chat box. Great, I've got it finally. Thank you. Sharing things with friends, talking about it. Friends, support, prayer, lovely. Keep these coming, guys. Prayer. A few more things, anyone? Anything different to what we've already heard? Time. Sharing things again, friend support. Listening, okay? And remember, I'm asking what helped you. Sleep, I'm very glad you mentioned that. Try and give me at least going for a long walk, physical exercise, brilliant. Try and come up with at least one thing that you found helpful in a highly stressful situation or a situation in which you were grieving or stressed. Try and come up with one thing. When you say listening, I'm not quite sure, you mean somebody listening to you or you listening to someone else? Just try and make that clear for me. Deep breathing, your parents, hugs, gaming, I presume you mean distraction, lovely. Going out to spend time with nature, great. Painting. music, yoga. Anything else anyone wants to add? Get my slides back. Is the screen being, Ahmed, can you answer me? Is the screen being shared with you again?
No.
It's not. I've lost my screen sharing now. I'm sorry about, I don't find Zoom easy to use at all. So I can't find the, here it is. Share screen, great, got it. Sorry about that, everyone. Lovely. Okay, thank you for all the ideas. Just see if any more have come in while I've been blundering. Chat. Okay, meditation, reciting the Quran, shopping, great. Listening to others' experience, I get you. Watching cartoons, very interesting. Thank you very much. Why I love to do this exercise. I'm very sorry, everybody. I'm having trouble with my screen. When I try and shut the chat, it fills the whole screen. And anyway, and now the slides won't advance. I don't know why not. Ahmed, I hate Zoom, or I need someone else to manage it for me. I can't make the slides go. I don't know what the problem is. If anybody wants me to give me advice, I'm trying to advance the slides and they're not advancing. I don't know what to do. Ah, finally. Okay, so sorry about this, everybody. I have no idea why. I do exactly the same thing 20 times and the slide won't go forward and then it does. So, but I'm very glad that you at least mentioned some of the things I have this list. I've got being listened to. I'm very interested that you added, and I may add this to my list, listening to others. Being treated with compassion, having people you love around you seems to be number one with everybody. Having hugs from your mother, having friends around you. Now, none of you mentioned some of these more practical things, perhaps because they are things you normally have in your life. But what I found, especially in disaster situations, is that people want to feel safe, they want information, and they want someone to provide food, water, and shelter. Now, what I've seen here in the community is actually, even in this situation, that's become very important, especially for people that are shielded or locked in their homes. The first slide I showed you, that man helping that other lady in Islamabad, providing food, that actually people don't often talk about the psychological issues. They talk about somebody came around and did the cooking, somebody took the children to school, somebody took care of those basic needs, and being treated in a dignified way. And also, of course, sometimes in these disastrous situations, people mention legal assistance. None of you mentioned that, but that's great, but it does come up. These things that you're listing show me that you all have the same basic instincts that we have, that you know what kind of help people need immediately after a stressful situation. And this is why we have this thing called psychological first aid. But I don't like the manuals and the teaching programs, because I think if you think, oh, there's a manual and there's a teaching program, I can't do it unless I do that program. Now, what I'm trying to make clear is that you actually know what those things are, and you've listed many of them. And all psychological first aid is formalizing them and giving them a kind of structure so that you don't forget any of those things when you're helping others. Look, listen, link. I prefer the word connect, but the person who was writing the manual likes the 3 L's, so he's got look, listen, link, but I like connect. Just think that's what you're doing. Look, what do we mean by that? When we're trying to help people, the first thing we want to do is Find out what kind of help they need. How can I help you? Whether you're calling on your neighbor after all her family have died in a traffic accident, whether you're helping somebody after a cyclone, whether you're helping someone in an earthquake or you're helping someone in a disease outbreak, you need to find out what their particular problems are. What do they need at this moment? And it might not be listening, it might be, where can I find food? Where can I get shelter? Where can I get information? They may just want to talk to you. And being able to listen, I told you the story in Sri Lanka of just sitting down and listening to that man in the street who'd lost his mother, being able to listen without putting any pressure or making someone talk is really important. Now, a lot of you said, me listening to someone else, and that's really important because the person you're helping may want you to give advice. They may not want to talk. They may want to listen themselves. So your job is not to come and say, make sure you talk about it, you need to talk, but to listen if they want to talk. And then the link, you need to connect people to the services they need. And sometimes they will be getting to a safe place. I don't know if you've been watching the TV pictures of what's going on in India and Bangladesh, but of course the big issue was, how do we get people to a safe place, even with all the problems of social distancing? And you saw how effectively the emergency services worked in those countries. Given the severity of the storm, the casualties were very small because of the evacuation. And then when they are in that safe place, have they got food? Is there family around them? Are there people around them who care about them? Remember how important hugs are? Have they got accurate information as to what to do next? What you're trying to do is help the person in this situation and make sure they continue to be safe. That is psychological first aid. And a lot of the people I work with in humanitarian situations tell me, well, actually, even if you ask me to do these things, in this situation in which I'm living and working, some of the things you've listed are not actually possible. So I can't, with this socially distancing rules, even go out myself maybe and help someone when I want to. Or we don't have clean water in this camp. Or we don't know how to find safe shelter in this situation. Can you give people information as to where they might get these things in the future? Can you, we all know, you all said hugs, family, friends, when social distancing in place, if they don't have the means to connect and get the hugs, are there other means to connect them socially? That's going to be really important, especially for the loneliest and most vulnerable people. And if you can't do it and you feel awful, don't worry. Can you at least advocate for it to happen when it's possible? Never forget that even if you can't do the things you think a person needs, trying to think about how you might address those needs in the future will help you and help them. I like this list of do's and don'ts, not written by me, but they were sort of added to the psychological first aid, okay? And the do's are pretty straightforward. Be honest and trustworthy, of course. Don't be prejudiced, especially if you're dealing with people from other cultures. Respect other people's right to decide what they need. You may think, oh, what you need is this, this, and this. And they say, what I want is this right now. Or I want to talk to my husband right now. And you think, well, actually, you're soaking wet. You need dry clothes. No, I need to talk to my husband. Let them make the decision. Be clear. If they say, thanks very much, I don't need to help. I don't need your help. Say, okay, well, in the future, if you do need help, this is where you can find me. Confidentiality and privacy, always. And of course, respect for the person's culture, gender, age. You're never, I'm sure any of you are going to be exploitative. You're never going to ask for money. One of the things it's very easy to do, especially if you work for NGOs, as I do in aid worker situations, you come in, you do an assessment, you listen to everybody, say, I need this, 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 and this, and the person's given the impression that you are actually going to provide those things, and that is one of the worst things about helpers. They give the impression they're going to provide stuff when they can't or won't. Don't let people, it's not that you go in and lie, it's that you give the impression, even by asking, that somehow you can provide the things that they say they need. Make sure people understand exactly what you can do and what you can't do. I'm a psychologist. I really want to help you. I don't know where you can get legal assistance. But do you know, I'm going to find out. I'm sorry, I don't know at the moment. Don't be frightened to say you don't know or you can't do what they're asking. Don't be intrusive or pushy, of course. I've said again and again, I'm going to say it again and again. Don't force people to talk when they don't want to. Keep confidentiality and don't judge. Okay, know what other people are doing. If you try to act alone, one, you're going to get much more stressed. You'll have no one to turn to when you're told terrible stories or you feel you can't help and someone really needs one to help. You may cause confusion because you may be duplicating other efforts. You won't be able to connect people to the services they need. So if you want to help others, make sure you know who else is helping so that you know where to direct people when other people need other things that you can't offer. It is one of the most important things, that link bit of psychological first aid. I am not going to go through more formally about psychological first aid because I want to come on to the more specific treatments of stress. But I really recommend, there are so many online trainings now in the resources I've given you, especially the main resource, the MHPSS COVID-19 resources. There are lots of trainings, slides, manuals. The WHO manual is freely available in multiple languages online, and I give you a resource for it. There's also an orientation manual coming out. I'll make sure Ahmed has that when it's published. What I do want to do is share with you some of the things I've learned directly from helping people. Because actually, if you listen to people, they tell you what they need. That's why I did the exercise at the beginning. And the most interesting situation in which I've worked has been the migrant crisis in Europe in the last 4 years. Why? Because very strangely, the people in Europe who've come from all over the world, including many from Pakistan, have not had NGOs helping them, have not had the UN helping them, have been very badly treated by European countries and have had to help themselves. And when you see people living in squalor on the border of Greece and Macedonia, and honestly the conditions here were worse than after the Balakot earthquake in Pakistan, and they were worse because people didn't want them there and didn't want to help, and the police were trying to get rid of them. You see what people will do for themselves. You also see very curious things going on. One is, for example, here's this woman saying, help us, it's cold, living in squalor with her small children. I'm not sure where she's from. There are big tents being put up behind her. Those tents were actually finally put up by MSF, which is one of the agencies that did try to help. But people didn't want to move into them. Why not? Look what's going on here. Again, you see the big tents in the background. Somebody, unmute people. Oh, sorry. I'd like someone to call out because I'm not going to try and mess up my slides by opening the chat again. If you turn off on your unmute, why, just someone say, why didn't people want to move into the big tents and they stayed in these squalid little tents? Why? Anyone? Anyone want to give me an answer? Anyone can unmute their microphone.
Now you have
access to unmute yourself. Okay, so no issue. You can unmute yourself and answer.
I'd love to hear your voices. And it's too difficult using the chat. It turns off my screen. Ahmed, if no one's going to answer, I'm going to ask you.
I'm also confused why people not go inside. They're big tents and why they are outside. Maybe they're...
What's going on in this picture? What can you see in this picture from a psychological point of view?
Psychological point of view, they are talking to each other and...
happy? They've got a fire, they've got a shisha, whatever you call it.
Yes.
Hi. Hello, Lynne. Can I answer this?
Please, please.
Yeah, I suppose like they want to feel more in charge of their own health, and they like do not want to get any external help, and they might have some trust issues like with the foreign NGOs and something. So.
Oh, very true. But what I hope the picture conveyed is keeping their little rotten little tents out in the open. They can make circles, they can make a fireplace, they can create the feeling of connection and community. In the big tents, They have long rows of bunks. You can't choose where you sleep. You may be separated from your friends and family. You certainly can't have a fire and a shisha and have a communal meal. All
Yes.
those things are more
Beautiful.
important to being dry they'd rather be in a wet little tent sitting around a fire than in a dry tent in a row of bunks. Do you understand?
Yeah,
That's a
thank
very
you.
important lesson. If you're going to help people, try and do it in a way that allows them to maintain social connection. So when the French in Calais came along and built these bunkers, their containers with exactly the same rows of beds, a toilet outside, nobody wanted to move from their homemade shelters, which were for families and had fireplaces in. They wanted to stay in the community they'd built for themselves. Another thing people were always saying is give us information. I mean, a lot of agencies realize that what you've got to do is give people the information, especially when they're on the move. And people want to connect to family back home. One of the best self-helps was this van which brought chargers so people could charge their mobile phones so they could phone home.
Yes.
And people also will recreate normality in the middle of nowhere. They'll have barbershops going, they'll be baking on the ground, they will do everything they can in the middle of the mud with police all around them trying to get rid of them, with a closed border, with no proper food or water. They're trying to recreate normality. And when people do come in and do distributions, they often did it in a way that was very undignified. It was first come, first served, strongest, best. By organizing queues, this woman is trying to entertain the people in the queue. By making people feel cheerful with the flowers and the painting, you can actually make people receive what is a handout in a dignified way. Children will always create places to play, even if they're not very safe, like that dirty water. So, and this is Pakistani men playing cricket. I thought you like in the middle of the northern Greece, you managed to create a cricket patch and have a game of cricket. I think it's brilliant. And people want to learn and study. This is on Lesbos, where 20,000 people are crammed into horrible, dirty tents in really unhygienic conditions. Somebody has created a self-help, and these women are learning, these are Afghan women learning to fix computers. One of the best psychosocial projects I've ever seen. Why is it good? Because this is a job you can do without a license. They learn really fast. They can put up a sign saying, I can fix your mobile phone and computer. And their husbands are delighted because they're earning money. They're really one of the best projects. And they were so happy. Of course, it was a communal, lovely exercise, and they came away with an important skill. Also had mother and baby tents, another way of creating community, addressing spiritual needs. Ethiopian and Eritreans built their own church in the middle of the jungle in Calais. When they didn't have anything else, they built a church. And people need beauty. People will go, even in the most squalid conditions, you give them lots of little dogs and animals and they'll hang them on a tree to make it look good. You give them some paint and they'll paint their little shelters. I know this picture became very famous. And now I do need you to mute because otherwise I get confused. But what I love about this picture is you see, of course, everybody's touching each other, social connection. This woman has brought her cat from Syria, became a very famous cat, actually. You know, pets are very important to children and family, their psychosocial support, but it shows you how important these social connections are, including animals. And of course, people want human rights. I'm not sure, I think this man is from Afghanistan, and they're protesting at the border to be allowed to move through. So these are psychosocial needs. And my problem with the psychological first aid manuals is that they don't include this stuff. They're short manuals. I wanted to show you that if you ask refugees themselves, it's both more complicated and more simple. Keep that social world going. It is so important. I hope that this will work. I'm just going to show you how good refugees are helping each other. This is refugees cleaning up the rubbish in Greece because the Greeks weren't doing it. Just watch this 3-year-old. He's absolutely determined to help. They're all Syrian refugees, these. Don't worry, it's only a very short film, but it's worth it. Just going to work it out. That's blocked. just looking for how he can help. So if you give 3-year-olds the opportunity to help other people, they will. It's very impressive. And they learn fast. So, okay. You can't do any helping if you don't take care of yourself. So the next most important thing I want to tell you, one is that you do know how to help others. 2, you have to take care of yourself, okay? And you know this list, and I thought of doing it in the chat box, but it takes too much time, so I'm going to go through it, okay? You need, as I went over in the stress lecture, okay? You need to know what's stressing you out. Okay, you need to know where it's coming from, and you need to take time out from it. Now that means going to sleep, that means getting proper breaks, that means getting rest. If you work for someone else and they're not giving you time off, they're not giving you time to sleep and rest, don't work for them, because you're not going to be any good to them after 2 or 3 weeks anyway. All the agencies, the good agencies that I've ever worked for, have, if it's a real emergency, 1 day off in 7. If you're working 24/7, then you've got to stop at least once a week. And 4 or 5 days off every 8 weeks, completely away from the situation. Otherwise, you are really going to suffer. You must eat properly, have some structure to your day, take some exercise. You mentioned this again and again in the chat box. Thank you. You know it's good for others, it's good for you. Regular contact. I put while maintaining distancing because this is the time we're living in. And helping others. I showed you that film of that little boy. We all know our mental health improves when we help and we help others. We feel good. I've just been out in the street because a person in the village has died, and his wife, who's 80, asked that everybody would come and stand socially distanced in the street when the car went by to the house and then up to the church. So the whole village was out to show her that we cared. And we all feel like we're better and nicer people. Local mutual aid. Or I feel better if I spend a little bit of time on Facebook trying to publicize what's happening in Bangladesh to the Rohingyas, because that's my way of helping them from a very long way of helping, away. You mentioned games, you mentioned doing things, I haven't got the list in front of me, but you mentioned distraction. It's so important. Having nice things to do, poetry, art, nature, singing, video games, I don't mind. Taking your mind off whatever is going on. You really do know this list, but it's very nice you already mentioned these things. I'm going to come to the simple anxiety management techniques at the end if we have time. Somebody produced this locally, and I really like it, and I thought it's something that you could translate and reproduce it for yourselves. It's a looking after your mental well-being and self-isolation, and it's a flower, and it's based on the public health messages in the UK, which are always take 5. So it's got 5 petals. Connect to other people, and that might be over social media. Tell people if you need help. Don't be shy of doing that. Reach out to help others. Take notice. Try, and this comes from mindfulness, try and be in the present. My husband and I, every morning, we're very lucky, we have a room of glass, what's called a conservatory. It's very small, but there are so many birds around now, and we always eat breakfast there, and we watch all these birds that we really know well every morning, and it really is fun. We're also growing vegetables. We grow vegetables every year, some inside, and watching them grow. It's wonderful. I've started to learn about writing poetry. Start something. Do a class that you really enjoy, not because it's important for university. Do one for pleasure. I've already talked about helping others and being kind. You've repeatedly mentioned physical exercise. If I don't get exercise every day, I go bonkers. Just a walk up a hill, a walk along the cliffs where I live, really important. I'm going to say this again and again through this because sleep is the #1 mental health healer. It's been so neglected. If you are not turning off your screens an hour before you go to bed, you will not be sleeping well. Okay, how to help get more sleep? Of course, if you're sleeping in a distracting and noisy place, that can be very problematic, and you can find even blankets to, I often find myself in, if I'm in a tent, hanging up blankets to block out the noise or whatever. Okay, if somebody's coming to me and they're saying I'm not sleeping, giving me medication, I explain about it being a response to stress, and that the way to do it is not actually to take medication or alcohol. Coffee, of course, is going to make it worse, but if they increase their exercise, and I've put this one in red, remove technology. A psychiatrist rang me up, a friend of mine, and said, how are you doing? We had a little chat on Zoom, and she said, I'm not sleeping at all. And I said, well, I and my husband have banned our mobile phones from the bedroom. We just are not allowed to look at them. And she said, why? I said, don't you know about blue light? You know that blue light turns off your melatonin. What's melatonin? It's your naturally induced sleep hormone. If you turn it off, you won't sleep. So don't look at your mobile phone before you go to bed. That's all I'm going to say about it. If you want to ask me more in the question period, we can. Relaxation techniques help, and I'm going to, I hope, show you some at the end. All right, I'm going to skip this bit because I'm running a little bit late. Okay, like you've already mentioned some of the things that work for you in the first one, so we've covered that. Okay, I've got a little bit here, but specifically for people who are frontline workers in this pandemic. There's some extra things. If you're not well informed, I don't know about in Pakistan, but there is a mass of conspiracy theories going around. I learned this morning on the radio that in Britain, 46% of adults in one survey, 2,000 adults, 46% believe kind of lies and rubbish about COVID, like it comes from 5G masks, or it's a Chinese bioterrorist weapon, or whatever. This is stressing people out, and it's harmful and it's inaccurate. So if you're a frontline worker in this pandemic, whether you're a psychologist or a nurse, you need to be well informed. That doesn't mean you need to know the detail, but you need to know the basic facts. You will be less stressed and you will reduce other people's stress. Yes, we need to socially distance. That doesn't mean you can't talk to your grandmother standing in the street and she's upstairs in the apartment looking at you from the windows. No, it's not a good idea to hug her. Yes, it's a very good idea to phone her regularly. You need to know what's safe. You need to be advocating for proper protective materials, clothes, if you don't have them. That's part of the job. You need a rest space. One of the things we've been arguing for is nurses often don't have a room just to withdraw to and take a break. It's part of our job to advocate for that. And of case, if you need to just debrief, if you need to say what's been going on, you need someone to listen to you. But I'm going to come to this later. That does not mean you force people to talk. There should be no compulsory debriefing. I'm going to talk more about that later on. I've already talked about diet, proper sleep, and exercise, which applies to all stressful situations. The ability to connect all stressful situations and time away from the field. I know that none of you do these things, but it's worth knowing what they are and emphasizing them when you're teaching, okay? Don't drink, don't take drugs, don't take risks, don't take your feelings out on your friends, your work colleagues, and the people you're trying to help. Don't overeat, don't undereat. And this is a key one for people who want to help others. I can't take time off, I'm needed. There's no one else to work. No one is indispensable. And if you overwork and you go on too long, you will be a pain. You will start getting angry and irritable with your colleagues. You'll do harm to them. You'll do harm to yourself. So recognize that you can take time off. You can take time off and you'll do your job better if you do. So these are my sort of final points for this bit of the lecture. Oh, great, I'm just exactly at half time. Give yourself time, take days off, find beauty in the natural world. You've already mentioned this. Realize you're not indispensable. If someone says, no, I don't want to talk about it, they're not in denial. They don't want to talk about it. If someone does want to talk about it, they're not being weak. They need you to listen. People are different. Recognize that. And if your friends and your colleagues say, you need to take a break, you need to take a break. They know better than you. Okay, let's get on to actually treating stress and stress disorders, because we've got a lot of very, very stressed people. I'll just take a verbal pause there. I can catch my breath and sip a cup of tea. Does anybody have any, because this is more into the more sort of psychological treatment, medical treatment side, about that kind of psychological first aid and self-help section. Any questions on that? I've got like 3 minutes before halfway through the lecture. I'm very happy. Any questions about that? Just make them verbally, because I'm not going to try and bring the chat box up. If you can unmute people, or people unmute yourself. Any questions? If there's silence, I shall continue. I know there's a lag, that's my problem. You can anybody? Okay. Okay. Well, you can also ask at the end, there will be an opportunity. Let me just close this down again. Right. So, stress disorders. Don't do this to me. I put this picture up because we've really changed in our view of stress in the last half century. And so for those of you who are interested, in the Second World War in Britain, where we, my own family lived through the Blitz. My mother was a child, but she remembers it. The response to the Blitz was, pull yourself together, you can cope. When people went to an emergency department with a stress reaction, this is a quote from a study at that time, they were all told their reaction was due to fear. Fear was one they shared with all other patients and first aid workers. It was important they should return to their normal work, resist the temptation to exaggerate their experiences. There was acute emotional disturbance. I taught you about that last week. There was stupor. There was hysterical paraplegia. I talked to you about that last week. All 134 were discharged within 24 hours. Only 6 needed further treatment. That attitude, we called it the stiff upper lip, cope, carry on, keep calm, just carry on. Everyone's going through the same thing, was the way we treated stress reactions. And because everyone was doing it, it worked. Now, something happened in the 80s and we shifted our reaction. There was a big interest in, especially after the Vietnam War and the generation who had survived the Holocaust and now had children, people began to think, well, maybe there are other things going on. And in 1980, they introduced the diagnosis of PTSD, post-traumatic stress disorder, and acute stress disorder into the diagnostic manuals. Now, I'm not sure how much service they did this, because one of the problems, I think, was an over-pathologization. But there they are now. I've shared this reference with you. There is now, and I helped to write this, a WHO manual which covers much of what I'm going to say. And this is written not for psychiatrists or even for doctors. It's written for it's written for health workers with an easy to manage formulation. What's the problem? And many of the symptoms that are listed on what would be the left-hand side of the page are what I taught you about last week. And what we're going to be talking more about now is, once you've made your diagnosis, have they had a traumatic event? You remember I talked to you about that. Did these acute stress symptoms come on after the event? Are they having difficulty in day-to-day functioning? They've come to you for help. Now we're going to talk about what you do. And the first steps of it are just like psychological first aid. Listen, don't pressure the person to talk, assess needs and concerns, address people's physical needs, help people connect, address current stressors, okay, connect to social support, and then we come, and this is the bit I'm going to look at now, to some very important things, some do nots. And every disaster, why I emphasize them, is that when I went to Abbottabad, when I went to Balakot, when I went to Islamabad after the Pakistan earthquake, when I went to Indonesia after the tsunami, when I went to Haiti after the earthquake, when I went to the Philippines after Hurricane Haiyan, when I was working last year in Central America, what did I see my health worker colleagues do with stress reactions? Offer Valium, offer benzodiazepines. And now there are WHO guidelines. Again, I've referenced them at the end of the lecture, and they are clear. The research evidence is clear. It's been clear for years. Do not give stressed out people benzodiazepines. It does more harm than good. If you have access to it, CBT is good for people even if they've just got an acute stress reaction. That approach will work, but so will psychological first aid. But please, this is the do not for acute stress responses. Do not give drugs. Okay? If they're having difficulty sleeping, if they've got the kind of symptoms that I talked about last week, if they're hyperventilating, and I'm going to teach you these, the best first aid approaches are relaxation techniques, advice on sleep hygiene, which I've given you, and rebreathing. I'm going to show you those at the end of this talk. But again, even if they say, I'm not just stressed, doctor, I'm not sleeping, I'm not just stressed, please give me some drugs, I need some drugs to sleep. Note the recommendations, adults and children, and I've laid them out as they're laid out formally by WHO. The evidence, when it says strength of recommendation, it means there is good evidence if it's standard that this does or doesn't work, and there is good evidence from multiple reviews they don't work. Don't give them. I mean, I know you're not prescribers, but as psychologists, doctors, and other people will be asking your advice, and really get this message across. We talked last week about conversion disorders. The truth of that is that there's not a lot of understanding how to treat these problems, but I have found that listening, explanation can do a lot. And that's why it says take the psychological first aid approach. If somebody, let me give you an example. I have this young girl who's having not epilepsy, but these pseudo seizures. And I sit with her family and I explain that she doesn't have epilepsy. We've done the tests, that the seizures she have always come on when she's really, really stressed, and that family and I need to see what the triggers are. So we can help her understand her own responses. We don't say, oh, you're lying, you're pretending. She's not. This is what hysteria is. It's not a lie, it's not a pretense. But she needs to understand what sets it off so that we can help her feel better and not react in that way. Now, I've got another one here. We talked about hyperventilation last week. The techniques I'm going to show you, relaxation and rebreathing, are the best techniques. But there's an old-fashioned technique, and you may have seen it in your country, very common in mine, which was to take a paper bag and have the person breathe into it. That's because, as I explained to you last week, when someone's hyperventilating, they're producing they're breathing out too much CO2 and they don't have enough in their body. And the idea was, if you put a paper bag in front of them now, it's like I hope you can see me with my hands, then they rebreathe their own CO2. Don't do it because it has some risks. And so it says don't do it. Now, this is what was going on as well as giving benzodiazepines in all these disaster situations and stressful situations in which I've worked. There was something else going on. Lots of counselors and psychologists would arrive at the scene of the disaster. It was the same even 2 years ago when this building burned down in London. You may have heard about it in the news, but there was something called Grenfell Towers. It's a terrible fire. 60 people died. The fire services were stressed. The ambulance services were stressed. The surviving families were stressed. The volunteers were stressed. So I was doing a lot of teaching on stress. And guess what they thought they should be doing? They thought they should be doing debriefing. Psychological debriefing, and I put this poster up, people could teach you to do it in a day. What is debriefing? It first arrived in Britain in the mid-90s, was very popular, and the idea was that if you forced people to relive the event that they'd just experienced and then talk about it, they would feel better. And also, you'll prevent mental disorders later on. Okay? You should do it quickly after the event. You would have a group or an individual session, and you would have procedures that encourage them to ventilate their feelings. Okay? There's some formalized methods of this, like critical incident stress debriefing. Some of you may even have been taught this at university. This process has about 7 stages. You introduce, you go over, there was a fire, it was very tragic. You ask people going around in the group or individually if you're one-to-one, what were their thoughts and ideas when they were standing outside watching the fire or they were inside trapped in the flat. You ask them to re-experience their emotions, and then you tell them this is all normal. We would expect you to feel like this, and you help them disengage. What we've learned over 20 years since these techniques were introduced is, at best, they do nothing. At worst, they do harm. Okay? They don't prevent people getting PTSD. They may even make it more likely. And so what was common practice in my country, I hope it's not in yours, is whereas in the past, fire workers, ambulance brigade workers, police were forced to go to group or individual debriefing, that stopped. Something called the Cochrane reviews, if you're a doctor, you'll be familiar with them, you may know them if you're a clinical psychologist, are summaries of all the evidence that's available. That's why I've put them in print for you here. But the short message is, no evidence has been found that this procedure is effective. And note that my point in red, there is some suggestion that it may increase PTSD and depression. Same for multiple session and single session. And then people say, well, why isn't it working? It seems like a good idea. Get people to ventilate, very common in America and Britain. Well, people are different. As we said, some people don't want to talk, and being forced to do so is not good for them. People have different reactions to events. So if they're sat down in a group and they hear that one person is reacting in one way and another in another, they think, oh, am I not reacting the right way? And they begin to feel bad. Also, the re-exposure gets them, surprise, surprise, aroused. You remember I taught you about traumatic symptoms. They have gone to a lot of trouble to avoid being aroused. If you actually arouse them, you can increase the likelihood of PTSD. For some people, avoidance is adaptive. You do not want to disrupt that. You should not be forced to do everything. People don't all want to talk. They don't necessarily want to talk to strangers who went through the same event. Confidentiality, they don't want to share with people they've never met before. And they don't want to hear, I talked about this in the first lecture on grief, about other people's distress, because contrary to making you feel better, it actually makes you feel worse. So this is why WHO, and I've put it here, you can check, in 2012, and their advice has not changed in 8 years, psychological debriefing should not be used for people exposed to traumatic events as an intervention to reduce the risk of PTSD or anxiety or depression. Why have I spent this time on it? Because I'm afraid, and I teach a course every year, which is why I'm teaching you now, that I still find that people from all over the world are using this technique. And one of my main jobs is to teach you not to do harm. So if you come across people using it or talking about wanting to be trained in it, please share these slides, share this evidence base. You have it now, you understand this doesn't work. PFA, psychological first aid, which I went through at the beginning of the lecture, appears to be helpful. That means if someone does want to talk, yes, you listen. So if I do want to tell you what happened, I do want to tell you how I felt, great, listen to them. People are different. And I've gone over this again and again, see what they need, help them get the help they need, connect them to family, social support and information, protect them from further harm. Okay. Now, I've gone a little bit here. Oh, I've actually gone much faster than I thought. This is great. We can have a discussion. What I've put here is helping people to cope with problems. And it is the beginning of something that takes a whole lecture. It's actually called problem solving. And I may think, oh, I know how to do that. But actually, there are some formal processes. And in the reference section, I've put problem solving plus, which is a manual that helps you go through this in more detail, because it is enormously helpful. So you're sitting with a stressed person and they're bringing up one problem after, I haven't got anything to eat, I haven't got any food, I don't know what to do about the children, I'm feeling so stressed, I can't sleep at night, just everything's all over the place. So sitting with them and helping them not to feel overwhelmed, one way to approach this is say, look, I can see you've got loads of problems. Okay, look, let's just take a moment. Maybe we'll do some breathing and relaxation. I'll come to that. So you get them feeling calm. Now, I need you with me. Let's make a list of all your problems. Right. So you come up with a list of like 10 problems there. Say, all right, now let's just take the one of these that you think is A, really important, and B, that you can solve. So you might make 2 lists. Okay, the most important problem is that I have nowhere proper to live. Can that be solved? Second most important problem is that actually I don't have enough to eat. All right, now you know that down the road there's a food bank, but you don't know what to do about shelter. So you can say, well, let's think of the problems that with the person you're helping, the problems that we can solve as well as the ones most important. Now, I don't know what to do about the shelter right now, but I do know there's a food bank. Do you think that's somewhere you and your family could go to get food? Yes. All right, so shift problem number 2 to problem number 1 as a problem that can be solved. I hope you're getting the idea. So it's both prioritization, which are the most urgent problems, which are the most solvable problems, and you hopefully at the end of a session, and it can take an hour, come up with a little list of 1, 2, and 3 that are solvable. And that will help the person feel that they can cope, that they are actually in control. Remember, one of you, I said, feeling in control. You put your finger on it when you looked at that slide. People like to feel that they have some control. They're not just on the receiving end. You may need to ask them what they did in the past. How did you manage this in the past? Your children are fighting and screaming even more than they ever fought and screamed. What have you done? What techniques have helped you stop them fighting and screaming in the past? What have you done in the past, as I asked you at the very beginning of the lecture, to make yourself feel better? Oh, in the past, I would just take a moment, I'd look at the natural world. Well, okay, it's really distressing now, but can we just take a moment? Is there any bit of nature we can see, even if you're living in a crowded city? There are usually birds. There's usually the sky, if nothing else. There might be a tree. Can there be something that helps you feel better? Okay? Who can you turn to that even if they can't physically help you, will make you feel better? So who are the supports in your life? So in the problem solving, you get the problem list, but you also look through these suggestions to help people solve their problems. Now, I've gone through something that's in a manual in a page, because if I was teaching you problem solving, I'd have a 1-hour lecture on it. I really recommend that manual if you're working with people. It's really simple. It's written for lay workers. Anyone can use it. Okay? There are lots of other approaches that may be effective to helping people with stress. And one is, and you will know these better in your culture than me, and a lot of you mentioned prayer, faith-based and traditional treatments. If praying helps, recommend it, use it. Really important. And there may be particular techniques in your culture that you use for stress management. Great. Meditation, yoga, depending what religion, what culture you come from, but steal from other people's if it works. I've mentioned CBT a few times. Cognitive behavior therapy, some of you will know, has specific ways of approaching anxiety. And the first is explanation, which I spent a lot of time on last week. If people understand that little slide I gave you that last week, how fear produces physical symptoms, how physical symptoms can produce more fear, how we can reduce the physical symptoms, that's part of CBT. Explanation, let's understand what happened, let's understand our symptoms, let's understand how we can feel better and safe. I'm going to do rebreathing in a minute. You've all mentioned distraction and you've all mentioned nature. Really important. Helping others helps when you're feeling stressed. Taking exercise, being in touch. You'll see that I'm repeating myself again and again, but this is really important. Okay, health service providers. If there are any of you who are linked to health service, one of the things that happens, I don't know why there's a line on that slide, is that people come in and they create services specifically for trauma. Don't do that. Integrate what you're doing. Don't have a debriefing service or a trauma counseling service or a rape counseling service. Have a service that is part of the what is going on here? I don't know what's happened. I'm sorry. I don't know. Is somebody writing on my slides or what?
No,
Okay.
no.
Thank you. Okay. That was very funny. Anyway, yes, whatever you're doing, try and, if you're a counselor and you want to help, where's your local primary healthcare service, your local providers? Can you integrate with them or with the local volunteer groups or whatever, rather than being standalone? I've already talked about problem solving. Take a problem-focused approach. Deal with the symptoms that are the biggest problem at the moment. If someone's hyperventilating, you won't be able to do anything else until you've addressed hyperventilation. When you've addressed that, you can sit down with them and start talking about what those other problems are that they have. You're trying to help them get back on their feet. Nothing more, but nothing less. I'm going to talk about distinguishing memories because I think in this particular situation where a lot of people are grieving, understanding, I talked a little bit about this when I talked about grief, the difference between different kinds of memories is important. Restoring social connections, addressing practical problems. Right, let's come to the CBT, for treatment specifically for PTSD. I've talked about treating stress, now acute stress. Now I'm talking specifically about PTSD. I'm not expecting you to do these treatments, but knowing what treatments are right and wrong is important so that if you're going to refer to another service, you want to make sure they're doing a good job. You don't want to refer for debriefing. The treatments that seem to work with PTSD are cognitive behavioral therapy, eye movement desensitization, but stress management of the kind I've just discussed will also help. The flashbacks and hyperarousal are best helped by EMDR and CBT, and that's the evidence. Sometimes, if those treatments don't work, using an antidepressant may be helpful, but you see what the recommendation from WHO and the guidelines group is. Don't do that in the first instance. Try the psychological treatments first. Do not use drugs with children. Those are the key points from that slide. Okay? Debriefing doesn't work. Trauma-focused cognitive behavior therapy does work. You can't do it unless you're trained, but if you know someone who can offer it, you've got someone who's got severe flashbacks, has been sick for a month, is not functioning well, then TF-CBT would be my first line treatment. EMDR also works, eye movement desensitization. It's a specialized treatment. If it's available, great. If it's not, don't worry. This is another therapy. Again, it's specialized. I'm just telling you what's available. And worst case scenario, yes, serotonin-based SSRI type antidepressants, but don't give these to young people. And then stress management of the kind I've discussed at length in the first half of this lecture. It's worth doing even with people who've got more severe PTSD because you will help them feel better. So the PFA stress management approach I've discussed, everything I've discussed in the first half of this lecture is important also for PTSD, and you should do it, and you may make people feel a lot better, as faith-based treatments may also work. Okay, and EMDR, which is a complicated treatment to explain, isn't acceptable in some cultures, so don't impose it on people who don't want it. Okay, this is a little bit complicated, but it's worth, take your time with this slide later, because it's worth understanding. One of the problems with people who are losing, who are grieving in traumatic situations is you're not quite sure whether you're dealing with trauma or grief. And one of the things I will do if people are talking to me is I won't ask them to tell me about the traumatic loss. You know, my father died on a ventilator in hospital. I couldn't see him. I won't ask her to go through that experience and how bad she felt. But she's coming in and saying, somebody's coming in and says, I can't stop thinking about it. One of the things I want to sort out with my patient is the can't stop thinking about it experience. What's it like? Because that will affect the way I treat them. If they say, I can't stop thinking about it, but that makes me feel better, I like thinking about my son playing in the playground, bringing me flowers home from school. I think about tucking him up at bed at night. I can't stop thinking about him. I think about him all the time. But honestly, doctor, I feel better thinking about him. That is very different from, for example, a tsunami survivor I talked to. I said, you say you're thinking about your children all the time. He says, yes, I can't stop thinking about them. I see their faces in my arms and the water is pulling them away and they're drowning and I can't save them. So you don't have to talk about it if you don't want to. Say, no, I don't want to talk about it, but I can't stop. Those faces come to me all the day. That's a traumatic, intrusive memory. I'm not going to push that father to talk any more than he wants to, but I know he has a memory he doesn't want. And that's where the EMDR trauma-focused therapies are more important. With the grieving type memories, you have somebody who wants to hang on to their memories because they're good ones and they're very different. People who've got traumatic, painful memories don't want to hang them. So you couldn't set a simple question like, is this a memory? Is this memory in your head something that pushes itself in and you don't want it, or something you actually get some pleasure from? That simple question may be a very important one to ask. And then we work down this list. Are they thinking about it all the time? And it's a kind of longing. I just wish he was here. That's why I've kept the bedroom like it is. So I go in there and I think about him. I long for him. That's part of normal grief. Or is it that they're thinking about the traumatic event? I can't stop thinking about him on the ventilator and I hate thinking about him there. That's an anxious preoccupation. They're going to miss this person, okay? And anxiety is common in both disorders. And so is anger. But the anger is going to be different. It may be anger. It's normal for all of us to be angry that somebody died, things we didn't say. But if it's just kind of irritability and it's not focused on any aspect of the loss, it may be more from that you see in traumatic event. You get guilt in both experiences, but one may be, look, I didn't do enough. I didn't say the things I wanted to him. The survivor guilt, why him, not me? Why them, not me, is much more common in PTSD. You don't tend to get hypervigilance and autonomic arousal in grief. If someone is hypervigilant, then they may well have one of the key symptoms of PTSD that I described last week. Now, if they're alert and looking around the house, they're trying to get things together, they may have a kind of restless reaction in grief, which is more to do with searching and longing and yearning. Okay? As I said last week, in PTSD, you tend not to want to think about what happened and not be reminded of it. You don't want to go near the beach because of the flood. You don't want to go near that place where the house fell down. You don't want to go near the hospital because it reminds you of the person you lost. That is very different to mourning, and where we deliberately remember and we find ways to remember. And I've told you, I think in the lecture on grief, that, I was very jealous of my housekeeper having dreams about my grandmother every night after she died because she found them comforting, and I didn't have any dreams like that. But that's very different from repeated dreams of a traumatic event, which you actually want to stop because you just can't, you're too frightened to go to sleep. So I hope this is helpful in helping you, if you're talking to clients, sort out whether they're having PTSD symptoms or actually just grieving. Okay, this last point I want to make is quite important. Though, as I said, when PTSD became one of the most popular diagnoses, a lot of my friends and colleagues were thinking and writing about it. And one of the things they were saying is, the good thing, the convenient thing, if you like, in our society for this diagnosis of PTSD is that people with social problems that, are suffering from political events or asylum seekers are typical ones, for example, their problems are not actually that they've had a traumatic experience, but they've had to leave a country, they've got to seek health and social support. And by labeling them as PTSD, we stop them being a social and political problem and turn them into a medical problem. We pathologize and we depoliticize and remove the social and communal things that we have to address. Because if the asylum seeker was given the legal support they needed, the social connections they need to get through life, indeed the healthcare they need as well, given a way of integrating into the country, just taking them as an example, it's amazing how quickly you see their PTSD symptoms diminish. after the disaster, again, the person who can't get the shelter, address their basic needs. I gave you the example, I think, last week of the 2 experiences after a Chinese earthquake. It was on Monday. And the village that had less traumatic events and got less help had more PTSD. And the village that got the help, the aid workers coming in, the support, even though it had been through a bigger traumatic event, had much less PTSD, which shows you how important is social and communal support. Okay, I have got time. Good. Because I want to, I've never done this on Zoom before. I don't know how easy it will be. What I really want to do, let's do this. Okay, let's see if we can do something. I'm going to conduct an experiment with you guys. Would you be so kind? I'm trying to bring up my screen here. Here we go. You all got your initials. You're all really shy. Could you turn on your videos? You don't have to turn on your sound, but it would be lovely to see some faces. Indulge me. This is my last lecture. You can see mine. I want to see yours. Faces, guys. Ahmed's showing his face. Come on. Louisa, is that your daughter? What do you look like? Tasnim, what do you look like? Naina, Zainab. Great. Because we're going to do some rebreathing and muscular relaxation. And if I can see at least a few faces, I know that things are going okay. A few more faces? I've only got 2 up. Let me go to the next screen. And now I've only 2 people are brave enough. Come on, guys, give me a few more volunteers. No? Ahmed, what do I do? Why are people so shy?
I don't know. If you don't have any issue, please turn on your camera. So
brilliant, well done, thank you. This will help me because I'll know what I'm doing is getting some feedback. Right, now, these are my, as well as the psychological aspects of psychological first aid. I'm very sorry, the stress manual I gave you does include what I'm doing laid out as a procedure, but the PFA manuals don't actually lay it out. So I'm going to go through it with you. I have someone come in, and I'll give you an example where it worked perfectly. Last couple of years ago, I was working on the Mexican border in a shelter where a lot of Central American migrants had arrived. And one young woman was in a wheelchair. So you can imagine being a migrant on the move, in a shelter, not knowing where she was going, a terrifying situation. She was highly distressing. And her mother wheeled her into the room where we were doing a clinic. My husband's a GP, and so we were doing both physical and psychological things together. And she couldn't even talk. She was like, she was clearly, I could see from her chest movements, she was hyperventilating. And I couldn't ask her what the problem was because she couldn't talk. She was so distressed. There's a little article I'll send you, I wrote called Borderlands. I wrote for the Lancet, which tells the story in the same way. So the first thing I had to do was get her to calm down. And I can tell you, and I'm sure you know this, you'll say, what happens to you, any of you, if someone says to you, calm down? Do you calm down? And you can turn off your mics too. I'll turn on your mics too. Do you give me a shake of head? I know that I personally do not calm down when someone says calm down. The last thing that happens. But you can say, look, I can see that you feel physically probably short of breath. You're probably very frightened. I'm going to show you 2 things that will really help you feel better, and then we can talk about everything else. And the first thing I want to do is, one of the reasons you're feeling so awful, I'm talking calmly and quietly, you're feeling bad, is because you are breathing very fast, and that is making you feel physically unwell. And if the person is listening, I say, you're breathing fast, that's changing your blood chemistry. You're actually, in a way, almost poisoning yourself. So I have got to help you breathe slowly. Now, there are 2 ways of doing this. One is hand on chest, hand on stomach. I'm actually going to show you the other way, which is what's called alternate nostril breathing. And you can see me because you can see my face. So you can teach this on Zoom if I can teach it on Zoom. You're going to teach people to breathe in through one nostril and out through the other, so they breathe more slowly. And it has some other advantages as well. If you do yoga, you will know it. And the way you do it, and those of you who've got your screens on so I can see your faces, please do it with me so that I know I'm teaching you accurately. Put a finger on your nose. Great. Close one nostril with your thumb. Right. Now the other nostril is open. And at the same time as me, breathe in through that nostril. Hold your breath. Close the nostril. Open the one that was closed. Breathe out through that nostril. Breathe in again through the open nostril. Close that nostril. Open the other one. Breathe out. Keep that nostril open. Breathe in. Close it. Open the other one. Breathe out. Keep that nostril open. Breathe in. Close it. Open the other nostril. Breathe out. Keep that nostril open. Breathe in. Close it. Open the other nostril. Breathe out. I'm stopping. I'm going to talk. No, no, no. Keep your fingers there. I'm going to see if you do it because I can't do it and watch you. I have two kind volunteers. Breathe in through one nostril. Ahmed, have you closed one nostril? I can't see. No, close one nostril. That's it. Breathe in through the open nostril. Close that nostril. Close the one that's open. Open the other. Breathe out. Breathe in through that nostril. Close that nostril. Breathe out. You've got to close that nostril. Ahmed, you're doing it a different way from me. If you can see me clearly on the screens, guy, my middle finger is lying on the bone of my nose. I'm using my thumb to close my nostril. And this nostril is open. So I'm breathing in through this. Breathe in. And then I close it and open that one. Breathe out. I keep it open. Close it. Open the other one. Breathe out. Breathe in through that nostril. Close it. Breathe through the other one. You follow me? Let me see you, lovely
That's it.
Lillian. I want to see if you've got the idea. Breathe in. Close one nostril. Breathe in through the other. Close it. Breathe out. Breathe in through that. Close it. Breathe out. Breathe in through that. Close it. Breathe out. Breathe in through the alternate nostril. Okay, you have got it. You can now teach other people. Now, Lillian and Ahmed, two things. Did this slow your breathing down? Yes? Yes?
Yes.
Were you able to think about anything else when you were doing that exercise?
No.
It is the most brilliant exercise because, first of all, it's bizarre. You're kind of interesting. This young woman, she looked at me as this crazy doctor, but she was really interested. And I finally got her doing it with me. And it's a complete cognitive distraction exercise. It puts you in the present. It cleans your mind because you cannot think about your mother or the birds in the trees or the person banging on the front door if you're concentrating on this. This is why people use it in yoga, and they do it for 2 or 3 minutes minimum. I don't have time to do it for 2 or 3 minutes today, but I recommend it. It's called rebreathing, alternate nostril breathing. You can find YouTube videos. It's all the same. It slows down the breathing, so the CO2 goes up and the oxygen comes down, the chest pain diminishes, the muscle pains diminish, the dry mouth, all the hyperventilation symptoms reverse because you have slowed down the breathing. That's number one technique. Really, learn it. You can also learn the chest and abdomen tricks, which I don't have time. They're very simple. But the thing about moving the breathing from the chest to the abdomen, which I think is in the manual, is that it doesn't have the distraction effect that the alternate nostril breathing does, which is why I love it. Thank you so much, my kind volunteers. Don't disappear because we're going to learn one more thing. So I'm going to move right back from so I can, right, now I want you all to sit in your chairs comfortably. So move back from your screens if you're visible to me. Is anyone else visible? And I'm not, because I've got 3 screens here. Anyone else live? No? No, okay, I'm going back to my two kind volunteers, Ahmed and Lillian. Right, sit in your chair comfortably with your feet, your legs slightly apart, feet on the floor. And just, if I said just relax, you probably relaxed a bit, but you're not completely relaxed. Now, the thing about applied muscular relaxation is that you are going through every group of muscles in the body in a simple way, one by one, and you're first of all contracting them, and you're then letting them go. So you're teaching your patient to relax their body systematically. The ideal is if you've got a couch, lie them down, and they do it at night before they go to sleep. It will help with insomnia, it will help with hyperventilation, it will help with stress. I get families doing it as a group in Albania where they all have couches on the floor. We get everybody lying down on their couches on the floor together in the family, and the mother learns to do what I'm doing and gets everybody doing it together. Sure, you could do the same in Pakistan. So, starting with your feet, which are flat on the floor and I can't see them, curl up your feet so they're really tight, or point your toes down, I don't care, whichever you prefer, but just your feet. Contract the muscles in your feet and let them go. I can't show you, unfortunately. Curl them up and let them go. And now with your calves against the back of the chair legs, or legs together if you prefer, but just tighten up your calves. Try not to tighten. If you put your hands on the back of your calves, you can't see me. I've got my hands on the back of my calves like that, so I can feel myself contract them and then let them go. Feel them contract and let them go. Same with the thighs, just the thighs. I can push them into the chair and let them go. Push them into the chair and let them go.
If you will put your chair a little bit back, so I will see your foot.
Okay.
Yeah, a little bit more.
Yeah, but I'm going up the body now, Ahmed, so I need you to see all of me. Now, pull your stomach in. It's the hardest stomach in the world. And let it go. And again, let it go. Now pull your arse in. Tight-assed, as they say in Britain. That's a British expression. I hope it's not rude in Pakistan, but we say someone is tight-assed. A very tight-assed person is very stiff. And let it go. And again. And now your chest. You've got lots of medals on that chest. You're pushing it out. Your two shoulder blades are coming together. And let it go. And again. And let it go. And now your fists. You just want to punch someone in the face and let them go. And let them go. And now I do arms together, biceps and triceps. Tighten them up. Brilliant stuff, guys. That's very good. And let them go. And let them go. And now your shoulders. And let it go. And again. And let it go. And now your chin. Let it go. And again. And so the back, these are very tense muscles. And let them go. And again. And let it go. And then screw your face up. Oh, and let it go. And again. And let it go. And I did this with my patient in a wheelchair. And then I say, all right, now, slightly different. You're going to tighten up each set of muscles, but don't let them go till your whole body is tight. So start with your feet, then your calves, then your thighs, then your stomach, your arse, your chest, your hands, your arms, your shoulders, your chin. Screw up your face and stay like that while I count 10, 9, 8, 7, 6, 5, 4, 3, 2. Just let go your face, let your chin, your shoulders, your arms, your chest, your stomach, your arse, your legs, your feet, and you're just totally relaxed. How are you feeling? How are you feeling? Oh, I've got 2 thumbs up.
Relax.
Thank you. that I did again very fast. Actually, I normally do it twice with a patient, and I take 3 minutes or so with the rebreathing. And by the time I'd finished these 2 exercises, my young woman in her wheelchair was completely different. And so then we could talk about the problems that were causing her so much distress, which were all related to the lack of shelter, the migration, her dangers, and all the rest of it. So these are really first aid anxiety management techniques. All cognitive therapists use them. You really need to know them. You can find them on YouTube easily, and you can find them in the manuals. I hope they've been helpful. We do have, I'm very happy, I do have to leave in 4 minutes, but we have got time for questions. Please unmute yourself and ask any questions you like. I'm so glad I actually did get this lecture timed right. Yes. And I will be giving Ahmed the slides, not right this minute, but by the end of the day. Yes. Somebody, Sabahat, is connecting to audio, or I can stop the slide, so I could actually, yeah, you can put questions in the chat now because I'm not disrupting the slideshow anymore. Feel free to write your question in the chat, or I am not sir, but thank you. Sign up. It's very funny being called sir. Any questions? I hope you all enjoyed the relaxation. No questions, Ahmed? I don't know. I'm watching the chat. No, Lillian? How was that?
I actually have a question about something we discussed.
Can I just ask you, is that a t-shirt or are you a nurse in scrubs?
No, it's a t-shirt. I'm at home.
Okay, right.
So I live in Kuwait, and it's total lockdown here. So, so my question is, you mentioned that during World War II in Britain, they had I didn't feel like they were empathetic, I guess you could say. Like, it's okay with what you're going through.
You know, empathetic, no, it would be wrong to say they weren't empathetic, but the emphasis was on your resilience and coping.
Okay, so my question is, do you think psychology today is catering too much on taking care of people, and then their coping mechanisms are much less than before?
I think taking care of the people, first of all, kindness and taking care of people is a brilliant thing to do. If the emphasis is on pathology, on, oh, you must be sick, oh, I expect you're going to, there's all the stuff in the newspapers today I showed you last week. We expect all these doctors and nurses to have PTSD. I don't think that's helpful. Do you see what I mean? Let's see. First of all, we don't know, but constantly looking for pathology rather than emphasizing resilience, I think contributes to pathology. So then rather than think, oh, I've got a bit of a chest pain, oh, maybe this is the first symptom of PTSD, or rather than going, oh, you know, okay, I've been overdoing a bit, I need some more sleep. Do you see what I mean? That's not the same. It's not a lack of empathy, but I do think we could pay more attention to what keeps people well, which I've tried to put emphasis on here.
Okay.
Yeah? Does that help?
Thanks.
Does that answer your question? And Abia, I have a question about psychoeducation without bombarding. I agree about the info with written information. One of the most important topics and given to people. I think honest information about what we know, very simple. One is, of course, the stuff that keeps them safe. This is a highly infectious disease. The virus hangs around in the air. Whether you're locked down or not locked down, you can keep yourself safe by, I like the word, physical distancing. That means when you're standing still, a minimum of 2 meters. If you're moving, it probably needs to be 4 meters. If you're running, it needs to be 10. I don't need to explain the physiology of that to you. We need physical distancing. Wear a mask. Do you have mask rules in your countries? Wear a mask when you're in public. Why? Because that will protect other people from you, and then they will wear a mask and protect you. So to me, those 2 simple messages, it's highly infectious. Most people don't get it, but if you do, it can make you sick. Okay, and most people are asymptomatic, I meant to say, but if you do get the bad form, and young people can get the bad form, okay, can be very sick with it. So we should protect one another. That's my view. Based on experience, what is your opinion on chat online services? I think chat online services can be very helpful. And for some people, they're all we've got. I think doing Zoom, like, it makes such a difference to me to have Ahmed and Lillian's faces. So if you are going to do online, have the decency to show your face. You know, it's very intimidating to have a wall of initials. I will tell you that. It really is. Because you think, what I found hard about the lectures is you get no feedback. You know, having a thumbs up from Lillian, I feel like 100% better. Thank you. A smile, you know that something's working. Ahmed's laughing right now. I know I've made a little joke. You know, it really helps you as a teacher. So if it helps me as a teacher, think how better someone's going to feel when they don't want to just hear you on the phone. That Zoom is great. You know, let them see your face. How can we manage anger? Oh, it's a whole lecture, anger management. Okay. I can't really do much more because I have to go to another meeting. If you, as a group, decide that there's any topic that we've raised that you want in more depth, I think I need a break for 3 or 4 weeks because I've got a consultancy coming up. But next month I could probably do, I could say I could do 1 a month or something like that, Ahmed, you know, if you want more. Okay?
Yeah, sure, definitely. Yeah, sure. Thank you so much. You give your precious time to us, and this is one of the best lecture I ever attended from any psychiatrist or psychologist. This is the best lecture.
Give me some written feedback so I can give it to my. Actually, I said to you, what I'm going to do. Hey guys, that makes me remember. I'm going to send Ahmed a little very simple, a 3-part questionnaire, 1 for each lecture, and you anonymously you fill in the boxes 1 to 5. You know the usual thing. Smiley face, frowning face. You just tick the box. She was crap. She was good. You can put comments as well if you want, but basically you just have to tick boxes. He will send them out to you. He will get them back and he will send them to me. No rush over the next couple of weeks. That would be very helpful for me because we have an appraisal system in my country for doctors to keep our license to practice. If I do anything, I need to show not just nice messages, I actually need formal method, and I will send him the questionnaire. I forgot to do that because I'm a bit busy, but I will, if that's okay. It takes you 2 minutes. You can give some feedback. And feedback is helpful. I can make the lecture better. Okay. Okay, thank you very much, guys. Okay, I'll say goodbye then. I have to go to my other meeting. Goodbye. Lovely meeting you all. Bye.
Okay.
Special thank you to Lillian. Thank you.
Thank you.
I don't know how to leave. How do I leave? I'll leave. Here we go.
Yes.
Bye.
Okay. Sure. Okay, thank you so much for all of you for coming for this lecture, especially those who are coming out from the Pakistan. So thank you so much. Thank you so much. Okay, bye.